All right. You've got people coming in to the webinar, so I'll go ahead and get things started. Want to thank everyone and really appreciate your patience for those of you that might have gone through the multi-date scheduling that we went through, and this was all on my team. And being a fellow ADHDer, I wish I could say it was some extraordinary failure, but this was simply just problems on our part. But we're here today. I'm very excited because we've got a very important topic, something I've dealt with personally. I know many others deal with, and it particularly comes into play with ADHD, and that's the kind of the correlation between anxiety and depression. And I'm very happy to be joined today by Dr. David Toomey and Nicole Falcon, both who are providers here at ADHD Online and Mentavi Health. And they're going to both kind of go over a couple of the topics. Dr. Toomey is going to talk about anxiety. Nicole's going to talk about depression, and then we want to open it up to your questions. And so I encourage you, we want to spend the majority of the time today answering your question. So if you do have a question, put it in the Q&A at the bottom of the Zoom screen. It might be at the top, but you can go in there and we'll try to get to as many questions as we can throughout the webinar. But I'll turn it over now, let Dr. David Toomey start, and we will get going. Thanks for joining us, Dr. Toomey.
All right. Thanks, Boz. And hi, Nicole, and happy to be here, help everyone out, share a little bit of our knowledge. And like Boz, I also have ADHD. So if you see me fidgeting and squirming and moving around, obviously I'm not medicated presently. So anyways, we'll have some fun here. A little bit about me, 30 years. That's okay. 30 years in practice, family medicine, hospice medical director, chief science officer, one of those ADHD things, right? Something only can keep my attention for a little bit of time, and then I move on to something else and then on to something else. So, I live the dream. So, yep, go ahead.
Great. All right. Cool. Let's see. There you go.
Hi, I'm Nicole Falcon. I have been with ADHD Online for about 2 years. And my passion is mental health. This is my thing. I feel like I was born for it. Everything I live for. I've been practicing for a little over 10 years, and I'm from Texas, and I moved to Colorado about 2 years ago.
Great. All right. Well, Dr. Toomey, why don't you talk to us first, just telling us about ADHD?
Well, ADHD, it's a combination of things. There certainly is a genetic component. It's a neurodevelopmental disorder, and some of the characteristics are inattention, hyperactivity, or impulsivity. And what people don't always realize that 80% of the time, ADHD has a coexisting condition. So 50% of the time, people experience anxiety, and about another 15 or so percent is depression, with 7-8% of that is bipolar, and then a couple other mixed mood disorders on top of that. So someone says they have ADHD, 80% of the time they also have something else that coexists. So go ahead, we can use the next slide. And so, as I said, 50% of people with ADHD also experience anxiety. Now, a lot of people will experience anxiety and not know they have ADHD. So they may go to their primary care office, they may get treated for anxiety or oftentimes depression, and sometimes the medicines don't quite work. And, we see a lot of people on the platform that come to us that way. And as we delve into it, they complete their psychological assessment. And we find that they really underlying all of it is their ADHD. And, a lot of times we try to get that under control first and see what's left over as far as their anxiety and depression. But, anxiety characterized by feelings of worry and fear, and it interferes with your daily activities. Can be restless. People experience rapid heartbeats, sometimes, shortness of breath, and sometimes they don't even want to leave their homes. Sometimes you could experience anxiety if you're going to do a slide presentation or a webinar. Now I don't know if Nicole's experienced any, but we'll see. Anyways, next slide. So again, ADHD, people are impulsive and intrusive, and sometimes that feeds into the anxiety, and they worry more, makes them restless. That's part of what that fidgeting energy is. There is an irregularity in the dopamine and the serotonin link between ADHD and anxiety. Now, genetic history can increase the risk of either ADHD or anxiety, or having both of them, or in addition, other mental health disorders. So, and as I was alluding to, it is sometimes difficult. A lot of people go to their primary care office, and the primary care providers have a difficulty distinguishing, is this ADHD, is it anxiety, is depression? But like I said, 80% of the time it's both. So next slide. So how do we handle this? Well, I talked about it first. We try to, underlying all of it, and in many of these cases, is undiagnosed or untreated ADHD. And, I often start there. I want to handle that, eliminate that, or adequately treat it. And then I can see what's left over. And, and that is either leftover anxiety, signs and symptoms of anxiety, or signs and symptoms of depression. And so we have medications dedicated specifically for ADHD treatments, other ones that are specifically designated for anxiety or depression. And some of the medicines we use actually treat both conditions. In addition to that, there's many other lifestyle changes that we recommend that you make, and we can talk about those a little bit later in the Q&A. But it's really about a balance between, living life, using lifestyle changes, and medications. So, my favorite lifestyle changes are, I have a very regimented schedule, and I exercise. Growing up, given my age, they used to try to beat hyperactivity out of you. But I end up exercising twice a day, good half hour in the morning and a good half hour late afternoon and evening. And that always gave me a couple hours of focus afterwards. I never realized I was treating my own ADHD because it was undiagnosed. So, so we can talk more about this later.
Great. All right, well, we're going to switch over now to Nicole and talk about depression. Oh, you're on mute, Nicole.
There, sorry about that, guys. Like Dave was saying, that there are a lot of overlapping symptoms between either a mood disorder, anxiety, depression, and the ADHD. The main difference that you can see clinically is a mood disorder is something that is persistent. It doesn't change. It's not usually in relation to a trigger. Because of the emotional dysregulation that ADHD often presents. So that's how a lot of the mood disorders can overlap. Some of the things that we'll see that are in both disorders is just a central loss of interest in things. You don't feel like doing this, you don't feel like journaling if that was your thing. Maybe working out is an issue as well. You'll see different appetite and mood changes, either sleeping too much, sleeping not being able to sleep. One of what I see a lot clinically as well is the overwhelming feelings. Maybe feeling like you can't get something done. I see that a lot. Maybe a task that should be very easy just comes very hard. Emptying I mean, even emptying the dishwasher can be, they might, someone with ADHD might procrastinate it, put it off, put it off. Someone who is more depressed, that might just feel so overwhelming for them that they can't get started, can't complete it as well. And then the constant fatigue, low energy, that's a lot of the motivation and just overall deficient in the dopamine response for both disorders. Okay, let's see. There is a link between the ADHD and depression. When you look at brain scans, it's affected by the same area. So it only makes sense that you're going to have some of the same symptoms. And both of them can actually impact academics, your relationships. It can get kind of stressful if one of you has ADHD and you're always forgetting things and you're not listening to your spouse. That can cause some major issue in just overall relationships. Okay. Social withdrawal, impulsivity, definitely isolating is seen in both of these disorders. Trouble focusing, you don't have the cognition to think clearly. Again, executive functioning is a component with both of them. It's interesting because the emotional regulation aspect of both ADHD and depression, it's interesting because in the DSM-5, emotional regulation is not even a criteria for diagnosing ADHD. And sometimes that is one of the main issues that is impacted by patients. Of recent, I've had a lot of people come to me that had previously stopped their antidepressant, and they're coming to me for saying, some low mood, low motivation. And although ADHD medications can help, they're, sorry, the questions are coming in, trying to ignore them. I'm getting distracted. Some of what we see is I have these patients coming to me that have already been off of their antidepressant once they get their ADHD diagnosis. They immediately think that they don't need it, they were misdiagnosed. And later what we find is a stimulant is not often enough for these patients, that they do in fact need their antidepressants or anti-anxiety medication. And you'll see that present in a way where, yeah, the stimulant's working, but it's often up and down, up and down. And there are certain antidepressants that work really well with stimulants. The behavioral therapy, cognitive behavioral therapy, and as Dave mentioned, exercise tends to, give people extra focus for temporarily. You'll see a lot of people managing or trying to self-manage their behaviors or their issues through exercise. You see that a lot. Medication has dramatically improved outcomes. And then everything else, diet, exercise, sleep, these are all very important just generally for your mental health. But then again, it becomes a little bit of an issue if you have a motivation issue to do those things. So, again, sometimes that's why medication is warranted. And of course, the stigma, I think the more we educate the public and the more people that get help, they're going to be able to be examples to other people and, hopefully get the word out there that this isn't something to be ashamed of. It's, not a character defect.
All right. Yeah. I think that that self-blame is probably one of the biggest things I hear as a commonality when I talk to other ADHDers. And I'm very excited. We've already the chat is active, um, and we've got a number of questions. So I'll just go ahead and get started. Again, I'll defer to questions in the Q&A. I'll try to keep track of the chat, but I'm not always able to do that in real time and keep my full attention, to be honest. So we're going to start with, we have a number of people that come to us that have previously dealt with substance use disorder and are in recovery. And so we had a question from Deborah. She asked about guanfacine, and she said, is this a good prescription for someone who is an addict in recovery? I mean, what types of things do you have to consider when you're in recovery and thinking about treatment for these types of conditions?
Well, I did see Deborah's question there in the chat, and when it comes to addictions, we do have alternatives of what we can use we have non-addicting, non-controlled substances that we can use to treat ADHD. Again, the hallmark of ADHD treatment is lifestyle change, and the medications they stimulate an area of the brain that was underdeveloped. And, if you are able to, the medication really helps you stay on track. And if you're able to become more self-aware, more connected with those lifestyle changes, that's what the medicine does help. And so we do have non-stimulant medications like lifenicin that she mentioned. That is one that we use in people that have prior addiction histories.
And also, I would just kind of want to go a little further that Dave, thank you, Dave. So the percentage of people who enter either substance abuse, treatment facilities, alcohol, 70% of them have undiagnosed ADHD. And that's a huge amount. And when you look at family history, they were not diagnosing ADHD very often 30, 40 years ago. But if you look at the family history, you'll see a lot of alcohol, substance abuse in their family. And, it always makes me wonder how these patients were properly medicated or even educated on, hey, you have this, dopamine reward deficiency, how do we overcome that, even if they didn't have medications? And these people that we're seeing a lot of are older adults who, have struggled their whole life, and to find out that they have ADHD, it's mind-blowing for them and life-changing when they start to get treatment, even if it's not with medication.
So
I will use a lot of guanfacine with a stimulant at times because it helps them work better together. Yeah.
Yep. Yeah, I was gonna just in context for everyone, 3 to 7% of people have ADHD. Now, that's diagnosed and undiagnosed. That's the best numbers we have right now. And 10 to 21% of all people who have a substance abuse disorder also have ADHD. So, so Deborah, that was part of your question, but, Nicole, to say as well, touching on that substance abuse disorder, lots of older people who were never diagnosed as children, they ended up gravitating, either they were from homes with substance abuse or they gravitated to substance abuse themselves when, their ADHD was really affecting them. Then it was undiagnosed. ADHD leads to higher bouts of unemployment, leads to higher rates of run-ins with the law, increased clumsiness, increased motor vehicle accidents, lots and lots of relationship issues that all these are very difficult to manage, and people, when they don't have enough of tools in their toolbox, tend to go to some addictions. And that's why we see that over, like I said, between 10 and 21% of people with ADHD have substance abuse disorders.
Yeah. And I'll just speak. I had mentioned it in the chat earlier, but I was diagnosed at 49. I had been diagnosed with depression and anxiety before, and it certainly, when I finally was diagnosed with ADHD, it just was like a puzzle kind of reverse coming together. Like all of a sudden, all these things made sense. And to your point, Dr. Toomey, I do take a stimulant, but I didn't at first, and I still have to do all the work. It's not some magic key that suddenly cures your ADHD. I tell people it just gets you over that, for like what for me was that hesitation, that lag of between intent and activity, and it just kind of, I don't know, it's amazing. So, but it's not about me. I want to get to more people's questions. Christopher asked, do you feel the medication is strictly needed to accommodate ADHD? And do you feel the same way when ADHD is complicated by other disorders such as depression and anxiety?
So, part of what we offer, through our platform here is a complete psychological assessment. Which does help us determine, do you have anxiety? Do you have depression? Do you have ADHD? Do you have a binge eating disorder? Do you have, a media addiction issue? So completing a comprehensive psychological assessment, very, very helpful for the provider, because what we want to do is have a great provider-patient relationship. And how can we do that? Well, we want to be the most informed. We want to be able to tailor a treatment regimen program to you. So as Boz said, and I mentioned, medication doesn't do everything for you. It stimulates an area of your brain that's underdeveloped. And what that does, you start those lifestyle changes, getting up at the same time, going to bed at the same time. Exercise is important, 8 to 9 hours worth of sleep. I could go blind tomorrow and I could tell you where everything is in my house. That's how regimented and disciplined I am. But I've created my world out, for me to be able to function in without medication, actually, and so it can be done with or without medicine, or we use medicine to enhance that regimentation in your schedule until you're able to do it on your own. And yeah, there are times here I'm sitting like, okay, I see a shiny object over there. Oh, I got to go do that. Oh, I got to go do that. And, but I bring myself back in. I say, okay, no, I'm going to do this first. And I talk to myself a lot. So again, nothing's a magic cure. It's a lot of discipline. It's a lot of hard work. But yeah, it's not about me either, Boz, but ADHD people, we like to talk. So
yeah, it's true.
Yeah. We overshare, another we overshare and we overthink everything. So, welcome to the family.
Yeah.
When I look at that question, I'm like, is that strictly needed? And no, it's not. But if you found something to make things just a little bit easier, or the ability to actually implement what you need to do, that's part of the problem. We know what we need to do, but we have trouble with the execution because of the motivation issue. And so I feel like that's where medication is just, it's like a light switch for a lot of people that, they've struggled with for a while.
Mm-hmm. Yeah, I tell people I felt compelled. I mean, it just was, and that's the only word because it wasn't like I was suddenly a different person. I just was like, I got to get on that. I need to do it rather than just continue sitting here thinking about it. And it's not, trust me, it's not been perfect, but it's nice to feel like you're making progress. So let's get to the next one. An anonymous question. I found it impossible to establish the recommended habits despite knowing they help. Any suggestions?
Well, I think we just about answered that. Nicole did a good job of that. You
So
know, again,
what? I'm sorry,
it's that
go ahead.
it's that threshold. It's that threshold. If you take a little bit of medication and get you through that threshold, we can outline what those lifestyle changes are. It sounds like you know what you need to do. And again, it's about that. This just breaking through that barrier, turning that little switch on, as you said, Nicole.
One of the things that are evident in both disorders is the lack of dopamine. So, if you can find a way to reframe certain tasks where you're not focused on the actual work, but the reward, that's something that's going to be very beneficial if you are looking to, instill these habits long term without medication.
Great. All right. Let's see. Deborah asked, can you be diagnosed with bipolar and ADHD?
Yes, you can. My last patient last evening that I saw, yes, they came to us. They thought they had ADHD, and as I, completed, went through his assessment that he had completed, and ultimately he had both. I diagnosed him with bipolar as well as ADHD, but they commonly have overlapping symptoms. But yet there are certain criteria I look for in different diagnoses that separates them, but they can be individual or you may have them both together.
Great. All right, let's see. Fatima asked, how can I differentiate between ADHD and anxiety? And I know she also asked a question in the chat about the relationship to eating disorders. And you mentioned binge eating, Dr. Toomey, but
Yeah. So again, I think it's going to be a recurring theme here. Only 20% of people may have ADHD only. So 80% have ADHD and they have anxiety or depression or binge eating disorder. So again, it's imperative that you complete a thorough psychological assessment that helps us out as providers so that we know where to direct our efforts or direct the medicine or direct, where therapy is going to be best for you. And you can have multiple conditions at the same time. And when it comes to ADHD and binge eating disorder, they're actually one of the medications that we use treats both conditions, and that's Vyvanse.
yeah, great. All right, let's see. We've got a question from Eleonora, and it looks like she's got two parts, but she said, recently I went to a psychotherapist who immediately diagnosed me with bipolar 2, just from what I had written in my reasons for going to her. She encouraged me to be reevaluated and seek medication for BP2. However, I'm really happy with my ADHD meds and diagnosis. I think it's 1000% accurate and really effective for me. I read on Reddit other people's experiences of bipolar 2 and could see some relation to my experience, but I would say my symptoms are 5% in comparison to my ADHD symptoms and very minor in relation to other bipolar 2 people. I'm wondering if I actually do have it and if the degree to which I have it requires medication. Is it really possible to have ADHD and bipolar 2 at the same time? And is it advisable to be medicated for both? She's happy with her progress and doesn't want to do something that might take her off track in a negative way.
I mean, I think she answered her own question. I think it depends on like your functionality. How much are you impacted by not being treated by bipolar 2? And then again, you have the overlap of symptoms. It's, talking too much. Some of these are overlapping symptoms that maybe the stimulant is somewhat helping the bipolar being stabilized, especially if your emotions are regulated.
Right. So I think what I run into, most people, when it comes to bipolar, they probably spend 70-80% of their time in the low mood. And, and then about, the other, some in the middle, but, it's the manic episodes that can really, really get people into trouble. So, and most people with ADHD also have very low self-esteem. They always are comparing themselves against coworkers or family members, or they've underperformed most of their life. So that doesn't help the depression aspect of what they're feeling. So if you have bipolar and ADHD at the same time, it's like a double whammy to stay in that low depressive state. So I'm thinking what she's experiencing, so she feels 95% better. She's out of her lower depressed state because she's feeling, increased self-esteem and increased self-confidence. But yet, she's not, probably wasn't experiencing many, hypomanic states. And so I think as long as she's not there, she's right. If she can stay in the pocket of where she's feeling now, then I don't think she should change her therapy at this point.
Yep, that makes sense. And Eleanor, I see you've got another comment, but I think based on what Dr. Toomey and Falcon said, we're just going to keep moving just so we can cover as many people as possible. But thank you so much for asking. Okay, so we've got another one from Amy. She said, are there over-the-counter medications or supplements that are recommended for ADHD?
Go ahead,
I know
Nicole.
this is, yeah.
So, I mean, I don't know. I mean, yes, there are
There are
some.
a couple, yeah, there are some supplements out there. A lot of these supplements don't cross the blood-brain barrier. And so they're not going to be as effective in eliciting the, increasing your dopamine and norepinephrine. There is an amino acid called L-tyrosine that is said to be a precursor to norepinephrine. Some people have found benefit, some haven't. Again, these are over-the-counter medications that are not regulated by the FDA, so the research on them is very inconclusive.
So when it comes to, I think, supplements and brain health in general, so, a really good B complex vitamin, I usually recommend that. And magnesium, I also find that effective over in helping your overall brain health. So does it treat ADHD? Not really. A lot of the treatments that I looked at are just usually caffeine pills. They try to treat it with high caffeine pills. If you look on some of the labels, this treats ADHD, you'll see that it has high contents of caffeine. So, but supplements can help your overall brain health, but I don't think they don't really treat ADHD.
Great. And let's see, we've got a question from Diane. She said, can taking ADHD meds that increase endorphins cause depression in older adults when they stop taking the ADHD meds due to the reduction in chemically induced endorphins?
Absolutely. And I would say not just in older adults, but most all adults can have that reaction, definitely, when they stop something that increases dopamine.
Yeah, and what I was alluding to in some of my introduction stuff is about exercise. ADHD, people may have heard of like a runner's high or an exercise high. That's usually really experienced more profoundly by ADHD people.
Really?
Yes. So that's why, if you can do 20 to 30 minutes of a cardiovascular exercise, you get your heart rate up, walking quickly or on a stationary bike, treadmill, whatever it is, you will have 2 to 3 hours of focus because it increases those endorphins. Because in the ADHD brain, those endorphins are at a lower level, just like Nicole's saying. So yes, you take ADHD medicine, it stimulates, you get that effect where your endorphins are increased, but you get the same thing with exercise. And so that runner's high is experienced greater in the ADHD brain.
And that's
Never
one
heard
reason
that, but it makes sense.
see so many, sorry.
No.
That's one reason why we see so much impulsive eating, binge eating with that correlates with the ADHD. It will give you, every time you go to take a bite or you're grazing, you're getting a little bit of dopamine surge. And that is a largely linked together.
And it speaks to what we were talking about before about, getting those dopamine hits, having that lower level. So how do you get a dopamine hit? Well, you complete something, right? You complete a task. Well, why do ADHD people procrastinate? Well, they see something ahead of them. It seems too big. They'll think about it. They can't do it. But if they can break it up into a little piece, they can get a little dopamine hit from that. One of the things I recommend is, set a timer, 5 or 10 minutes. I'm going to focus on this project, or, I'm going to do 1 hour a day of cleaning. Not me personally, I've done it before, but clean out a closet. I know that closet seems overwhelming. I'm never going to do it. I'll overthink the whole thing, and then you never do it. But you know what? If I do that for an hour or even a half hour, set my timer, then like, wow, I feel like I've accomplished. I'm not all done, but you know what? I did a half hour's worth of work. And that's a positive reinforcement. That's a dopamine hit to your brain. And that's how you can get things accomplished. You just, how do you eat an elephant? One bite at a time, right? So same thing when it comes to ADHD, and trying to, take a task that seems overwhelming and that you just can't get started with. That's the best way to do it. And you can feed yourself. And so then eventually you'll look at a task that, and I know that's going to take me 3-4 days to do, but you have a technique in order to do it, and you can feel good all along while you're doing it, and you don't have this dread, where you have lack of motivation. So I find that very, very helpful.
Great tip.
One thing I'll tell my patients is, if you have a task and it seems so overwhelming, a lot of times we just ignore it, walk away, and just, put it out of our mind. But if you can break the task up, write down each single step. What do you need to accomplish this step? What do you need for this? It makes it a lot easier to actually go do that one thing. Most people don't. They will procrastinate because they don't know how to get started. They don't know what to get started with. They don't know what the first step is.
And how many parents out there have told your kids, hey, go clean your room, and the kid doesn't really do it. But it's best off if you can say, hey, just go make your bed. They go make their bed. Like, hey, why don't you put your clothes in the hamper? If you can, it's really holding the hand. And if you can teach, your children that at a young age, like that same thing, go clean your room. Very, it's a task. It's a very indiscriminate type task, and there's no steps that they can follow, so they're overwhelmed and they don't do it. But you say, hey, just go make bed.
You imagine all kinds of tasks behind it, but when you break it down like that, I've often found too, adding a time element, saying this shouldn't, knowing this subtask should take 5 minutes. Then it doesn't, like, call someone, that feels big, but if call 5 minutes, that's easy. So part of it is like, it's those little tricks to, again, I think, go for that dopamine, like, wow, okay, that works now. So the other question, this comes up quite often. Jamie asked, do stimulants mess with your anxiety or depression?
Well, that depends. Is your anxiety from the ADHD, or is it true anxiety? Anxiety is something that's going to be there. It's going to be kind of consistent, persistent. It doesn't necessarily change. Yes, there's triggers to anxiety, but if you have ADHD and then secondary anxiety, you're going to see a lot of, I'm worried about getting this done. I'm worried about, did I forget something? When it's generalized anxiety, it's usually like worrying about bad things happening, intrusive thoughts. It looks and presents a little different. And so basically the answer to the question would be, does it mess with it? If it is directly related to the ADHD, it will help it.
Mm-hmm.
Yeah, anxiety, it's usually future thinking. What if, it's things in the future. And, very simple. If we can just think of what we can control. Well, what can we control? We control ourselves. And what does that mean? Well, I can control my thoughts. I'm in charge of my thoughts. I'm in charge of my emotions, and I'm in charge of my actions. That's what I do and how I receive things. If you can really, really think of that and live from the inside out, anxiety disappears when you realize that you have no control really over what someone else thinks, because they probably have their own set of conditions and wounds within them. It's almost arrogant, on our parts to be worried what someone thinks of us. Why are we so important? That most people don't really care. They're only worried about themselves, So if you can really break down life to that, They talk, all you hear about all this mindfulness and self-aware and being connected. Well, that's what they're really talking about. Like, can I live really with, where does life start? It starts within myself, that I have control over everything I think. No one can influence that. Unfortunately, what happens with ADHD and anxiety, there's a gene, and that gene can get either gets turned on or it stays turned off. Well, what turns on the ADHD gene? A lot of it can be stress, stress that even when you were in the womb, if your mother, is carrying you and she has a stressful pregnancy, or, the couple isn't getting along. All ADHD people are highly sensitive people too. So that highly sensitive infant, either in the womb or within those first 2 years of life, detects, is able to understand, they get all that stressful input, and that's what turns the ADHD gene on. So those things have to be present. You have to have the gene for ADHD, and you have to be a highly sensitive person. And so then the environment takes over. And if you have, because there's plenty of people out there who are highly sensitive people that don't have ADHD, but I haven't found one person who has ADHD who's not highly sensitive.
So true. Well, just a quick clarifying question. Is that different if it's major depressive disorder or if it's depression and ADHD? I'm just wondering. Or is
No,
no.
no, it's not. Again, you're going to have the genes are there for anxiety, or are they there for depression, or are they there for bipolar? Are they there? What turns them on?
Right.
Why does bipolar not present itself until, late teens, early 20s? It's usually the gene has to be there, but what turns it on? Something extremely, extremely stressful at that time in people's lives.
Great. This next question is really good, and we hear this often, whether it's advocating for yourself to a pharmacist or a provider. So Jeremy asked, I've been trying so hard to talk to my psychiatrist that I know there's a direct link to my generalized anxiety disorder and my severe depressive disorder to my ADD. I told her I needed to continue on my medication of Adderall because it encompassed all three issues. She hasn't ever seemed quite convinced. How do I relay this information to her to help enlighten her?
I
I'm not sure if you
changed
can.
psychiatrists.
I don't think you're going to be able to change your mind, honestly. There's so many providers that are still in the same boat.
It is, I mean, there is
them.
still a stigma, and we hear this often from women that were, inattentive and were missed when they were young. But I mean, why do you think that is? Why are some providers just hesitant to support ADHD treatment?
Well, it comes down to, medical school class. I had 200 of us, and, what they called the person that finished last on my medical school class? They called him doctor when they graduated. Right. So just like, there's different varying degrees of people's talent as an electrician, or, whatever their career choice is, same thing with doctors. There is definitely a varying degree of how they treat people and what their abilities are. I'm going to guess that psychiatrist probably isn't a highly sensitive person, and I know, I am, that's why, I do what I do. I'm very empathic, and I'll spend the extra time with the patient. And I truly, truly want to help them, because these things that we do are life-changing for so many people. I want to see them reach their full potential. I actually think it's part of, it's definitely why I do what I do. I love it. So, yeah.
All right, well, we got an anonymous question. Does ADHD get worse as you age?
I would say, I think what gets worse is how many responsibilities we have. Some of the questions I ask when a person comes to me, it could be late 20s or 30s, or the first time they're presenting, they're 44 or 50 years old. I'm saying, well, what are the top, couple of things where you think ADHD affects you, and why do you want to get help now? And usually I find out that they've had extra responsibilities, either from work or relationship or children, and the ADHD was always there. They just don't have, they're past, their window, right? And they're out of tools in their toolbox. And that's usually what happens. So in general, it's just more responsibilities. And and some people who I'm treating for ADHD, they come to me and they say, hey, you know what, the medicine's not working anymore. And then I have to ask them, I said, well, what's changed in your life? Well, now I'm working 16 hours, and they gave me 2 people out on maternity leave, and now I have to do their jobs. And it's not that the medicine isn't working. So it's that the responsibilities that we have as adults, we take too much on, and sometimes we don't have enough of tools in that toolbox.
Right. We're not robots. We still have to take breaks and take self-care. We can't just keep going on. I see a lot of hormones in women affect their medication effectiveness during, the week before the menstrual cycle. And then also perimenopause is another time where women also struggle with, their ADHD symptoms become really apparent.
Well, and I know we've heard a number of examples of retirees kind of discovering ADHD upon retirement, because suddenly their routine changes, right? And the body doubling they didn't realize they were doing, some of the just, things I'm still learning about.
Well, and you start to lose your excuses when you're not working, right?
Right.
So for 30, 40 years, you're working. He's like, I can't get to that. I'm working. I'm busy. I'm working. So when you take all that away and you're still not getting it done, it's like, what's really going on here?
That's interesting. We just had a podcast episode about that, where a gentleman shared his story where it was retirement, where it came out. And he had all these things that he was normally getting projects done, but suddenly upon retiring, he just couldn't. So
he was not accountable to anyone but himself anymore. And that's
right.
where that's what happens, so that's where that self-discipline is, and having that regimented schedule, and that's why, when COVID came about, it seemed like there was a surge in diagnosis of ADHD. Well, why? Because people were left to their own at home. They weren't accountable to the boss, walking by and like, hey, I need you to get this done now. They just weren't accountable. They didn't have that same pressure on them.
Mm-hmm. Great. All right, let's see. Jana asked, is there a comorbidity between ADHD and autism, or is it typically that one or the other was misdiagnosed?
That they can coexist. I see it quite often. So I can't give you a specific percentage, but they do coexist.
Typically, almost always, you will have both most of the time. And that's just because in the brain, it's one, underdeveloped, and it's not communicating properly with the other parts of the brain. In the ADHD, you got one part of your brain that's in overdrive, always thinking, go, go, go. And then there's another part of your brain that's in underdrive. And so that's one reason why medications are so effective, because it balances out those two parts of the brain. Like, one needs the brake, one needs the gas. And so, you want to be a little bit more balanced. And then with autism, that is still like, a neurodivergent like comorbidity. And yes, that's about it.
Great. Let's see, we got an anonymous question. I just started today on a low dose extended release Adderall, 5 milligrams, and noticed a difference for a few hours, which wore off. Should I notice a difference with more time?
So normally when, we start a person, and let's say it's a stimulant like you're speaking of, my goal is to, improve that person's symptoms by at least 50% and get them medication that lasts on average about 10 hours. So at your follow-up visit, I think it's important that you tell your doctor, hey, I took it at this time. I felt that to start to work after this much time, and it seemed like it was effective for this long. And that's valuable feedback that I always ask at my follow-up visits. So it sounds like, you need to share that at your follow-up visit.
Great. All right, so this is an interesting one because we hear about this all the time. So Samantha asked, can you speak to the similarities and differences between ADHD as a topic that's popular like on TikTok and social media where people talk about distraction and hyperactive, versus perhaps a more professional definition of ADHD? I mean, we know we've seen studies that there's a tremendous amount of misinformation on social media just in general about mental health and ADHD in particular. But do either of you have thoughts?
Well, I can tell you, I don't do anything with social media. This is probably the only social media I've ever done in a long time, because, I find it overstimulating to me. I don't even watch the news. And so I don't know really what misinformation is out there. I can recommend a couple books. I would read books by, leaders in the field of ADHD. And there's a couple. And, I don't know if I can mention them here or not.
Yeah, oh, absolutely. Sure.
Okay. So, a couple, Dr. Hollowell has several books about ADHD. One of my other favorite books is called Scattered. Dr. Matei writes that. He's a fellow ADHD hospice, survivor, in the womb during the Jewish Holocaust. And there's another book. It's I really like it. I recommend to my couples. It's a book about ADHD in marriage and in relationships where it takes the perspective when both partners have ADHD or one partner has ADHD and the other doesn't, and the book goes back and forth and it shares their perspectives. I find it really, really helpful when couples are struggling.
What book was that again? What was the name of it?
I can't remember the author's name. It's written by.
Is it Melissa Orlov?
Yes, it is.
Relationships, and we've
Yep.
we've actually done webinars with her. She's been on the podcast. She's amazing. So I would endorse that as well. She really does a great job.
So I would dismiss most of the TikTok, Dr. Google or whatever you want to call it, and I'd go to some sources like that. And I'm sure there are lots of truths on TikTok, but or whatever it is. But I like to stay with the literature. And if you have ADHD and you're not medicated, maybe you can at least listen to the Audible versions.
Let's see. So we got an anonymous question. I'm 55 and recently diagnosed with ADHD. I've tried decades of treatment for depression that have been only somewhat effective. I'm a few weeks into trying generic Vyvanse while maintaining an SSRI. I'm generally an optimist, but I'll admit that due to my history, I'm skeptical that ADHD treatment is going to also adequately help address my depressive issues. How long might I expect this treatment approach to take to reach full effectiveness?
Well, I can tell you to treat the ADHD, again, typically I'll see, initial visit, I'll see you back again in 3 to 4 weeks, and then I'll see you back again in another 3 to 4 weeks if I've done a dose adjustment. Usually, when it comes to the effectiveness of ADHD medicines and side effects that you'll experience, that'll be pretty much figured out between 60 and 90 days. That's been my experience. I've been doing this for 30 years. And so once you manage the ADHD component and you sort of put that to the side, that's stable, then you can aggressively really see what's left over, the remnants of the depression. And, the part of what you tell in your story there that you've been on depression medicines for, a good majority of your life, and they were, somewhat, not always effective or intermittently effective. Very, very common story. We a lot of people, they've been on different SSRIs or an SNRI, and they come to us and, once we treat their ADHD, their anxiety or their depression is markedly improved. So, I think you should be very, very helpful. And again, one of the most important things is what we tell ourselves and how we talk to ourselves. So that, that self-doubt that you're, I hear in the question, I try to eliminate that. I don't speak to myself that way. I speak to myself very positively. I try to speak to myself with the same care and kindness and compassion and forgiveness that I treat my patients with. A long time in my life, I didn't do that. And I think a lot of ADHD people don't do that. They treat themselves pretty harshly. They judge themselves. And, when I finally learned that lesson, it was a lot of burden was lifted from me. And, all of a sudden, yeah, the ADHD became a lot easier to manage. And, whatever, I might have been anxious about or feeling depressed about or whatever, it didn't carry the same weight anymore. So just the way you talk to yourself too a little bit. And I think when, your ADHD is treated, you have much better self-esteem, more self-confidence, and it's amazing how much more kind you'll be to yourself.
I see a lot of patients that still need their antidepressant. I just see that the stimulant isn't always effective in maintaining all of their symptoms. There are a lot of people where the stimulant is enough to be able to do what Dave is talking about, the self-talk, the exercise, and that thing. Really,
Yeah.
ultimately, it's a combination of all of them that's really going to make things manageable and make you be able to function. It's very individualized as well.
Yeah, and I mean, just to offer you some hope, I mean, I'm 51 now. Sounds very similar to me. I am still on a low dose of Prozac and a stimulant, and I just find it's working. I mean, I've gotten to a point, again, it's not perfect, but I know that I'm putting a lot of time and effort into focusing back on what I want to change, not just expecting it to change. So it's never easy. I wish you well, all of you, because it's a journey. Let's see. Diego had a question, and we've only got a few more minutes, so I apologize. We're not going to be able to get to all the questions. It's been really engaging, and really appreciate everyone's questions. But Diego asked, are there any issues with memory after stopping ADHD meds? Either of you run into that?
I think, if he's been on ADHD medicines, I hear sometimes, before you're ever on the medicine, people describe a mental fog, or they're having, executive dysfunction, where their memory is poor. And, we medicate them, they're treated. And that, I hear like, oh, that mental fog's gone. Finally, everything is so clear. And so people get accustomed to, even though they have an ADD brain, that they have, now it's a non-ADHD brain when it's medicated. And so then when they sometimes stop the medication, what they really experience is what they always experienced before being medicated. So I don't necessarily think it's a worsening of the memory. It's just like they had this period of time where there was no fog and they had such clarity. And so they just sort of, go back to what they were before, if they haven't been able to institute so many of those lifestyle changes and really stick with it.
Great. Let's see. We'll probably do this last one or two. Fatima asked, she'd also asked about the binge eating. What about bulimia? Is that related at all, or is that something different?
So with bulimia, part of it is, so you still have the binge eating aspect of it, but with bulimia, you also have the body just more bigger. And that has to be a diagnosis that goes along with the bulimia that the binge eating doesn't.
All right. Let's see. We'll make this the last one. I'm not an anonymous question. I'm not on medication, and I haven't been able to find a good psychiatrist in my area. Tried an online psychiatry, which also didn't work. How can I find a reliable, understanding doctor?
ADHD online. Come on. Like,
I know that's like the
I mean, yeah, again, even though, I've worked for them for a couple of years, I've also helped out, several other platforms. I have 30 years of experience. And I really believe in what we do. I mean, the complete psychological assessment that you get before you even see the provider is the best in the business. Again, I'm proud to work here. I'm proud to be a
too.
part of this. I'm proud to make a difference in people's lives. I don't recommend things that I don't believe in. And so I would encourage you to come to the website. I know I sound like a salesperson, but I believe in it. I really do. And they're not going to pay me extra to say this, but I do. I believe in it. I believe in helping people, and I think this is a great venue to do it. So please reach out.
Completely agree. And, I'll just end on this. We are offering everyone that's attended the webinar today $23 off of the assessment. You can use the code webinar23 if you're taking our online assessment to get that $23 in savings. October closed out, and that was ADHD Awareness Month. But for us and our patients, this is every day. And so, again, I apologize to all of you that we couldn't get to your questions. It's just a signal to us of the need to continue doing these webinars. It's part of why we're here, part of why we like to do this, because we know there just aren't enough opportunities to get your questions answered. So we'll do our best to keep doing more of these. We'll follow up with all of you. We'll be posting a recording of this on our website. You'll get notice of that when it goes up. And thank you all so much. Thank you, Dr. Toomey, for joining. Nicole Falcon, thank you for joining. Really appreciate your expertise. And we look forward to seeing you all next time. And we'll see you soon.
All right. Thanks, everyone.
Bye.
Thank you.